Let's talk about Kenny Pickett's knee injury. So on Sunday, the quarterback for the Pittsburgh Steelers went down during a sack and his knee was twisted. And initially they were concerned for an ACL injury. And then when they ruled that out on the field during their sideline assessment, they then got an MRI and they were thinking that he may have an MCL sprain. However, the MRI showed that the MCL was fine, but that there was a bone bruise within his knee. So what I'd like to do is just talk about what a bone bruise is and a little bit more about how we treat this as well. So when we talk about a bone bruise, it's usually incurred by some type of trauma to the knee, in which case then we get this underlying bleeding or microtrauma that occurs within the bone itself. This is obviously not as significant as, say, a fracture, but it is still a traumatic injury to the bone itself. The big thing that we need to make sure of, though, is the location of where the bone bruise is. So when we talk about bone bruises, they can occur, for example, in an area of the knee that is involved with weight bearing that you put pressure on as you walk, run, sprint, pivot, or do whatever your sport or activity demands. However, it seems like in the case of Kenny Pickett, he's termed day to day and may even be active for Sunday, in which case then we're thinking that the bone bruise itself may have been a little bit more minor than what they originally thought during the injury. And then the second thing is that it's unlikely that the bone bruise occurred in an area that normally accepts weight on the knee, in which case then, kind of like when you have a bone bruise or a bruise on your shin, what happens is as long as you don't poke it, it's not going to be as painful. And so likely then it'll heal a little bit better and it won't be as limiting when he's out on the field trying to push through or play through pain. Now, this is not Kenny Pickett's MRI. That's just for the Steelers medical staff. Rather, this is just an example of what an MRI can show for a bone bruise type injury. And what we see is that there's a bruise, yes, on the bottom part of the bone, but then that bruise pattern, those white streaks, they trickle up into the bone itself. The issue with bone bruises is that they don't have as good blood supply as, say, your skin or your muscles. The reason why that's important is that the better blood supply an area has, the easier it is for your body to bring in healing nutrients and to carry waste products away. So therefore, the healing time is usually a little bit faster and the risk for re-injury is a little bit lower. With a bone bruise, bones don't have as good blood supply, so therefore sometimes it takes a little bit longer to heal. Given that Kenny is potentially going to play on Sunday, what we're thinking is that the bone bruise was probably very small. And again, like we mentioned before, likely not on a spot that's involved with a lot of weight bearing or pivoting or things like that, but rather he may have just had a minor small bone bruise on an area that just happened to get a knock on it just because of the extreme mechanism of injury with that extreme twisting that he had during the sack on Sunday. So given some of this information, what are the goals for his rehab and getting back to either Sunday, or the Steelers in this case also have a bye week the following week. So what's going to be important for Kenny Pickett to get back to full return to play is obviously make sure that his symptoms and his pain don't get so bad. However, given that he's an NFL player, like with some of the other injuries that we talked about, a lot of times those are handled a little bit more aggressively, in which case some pain medication may be administered to mask the pain while he's playing so he doesn't get distracted by that pain. The other thing is that in a bone bruise, the quad muscle goes into self-protect mode after a particular trauma, like the incident that he has and like a bone bruise incident as well. And so the biggest thing will be to make sure that he restarts or jumpstarts his quad muscle to regain that full strength, as well as any swelling to make sure that he regains full range of motion. Given that he's a right-handed quarterback and this injury occurred on his left knee, he's looking for that left knee to provide some type of stability as he steps through during his quarterback throwing motion. So making sure that that left knee is strong enough to be able to tolerate that amount of pressure without so much pain that it's distracting him from actual gameplay is really going to be the goal, managing his symptoms moving forward. So it'll be interesting to see how he plays, if he does, and how much playing time he gets on Sunday against the Ravens.